So as we wrap up, we're going to focus today specifically on incorporating evidence-based practice into our daily clinical practice. Now, we've obviously been talking about this the entire time, but in summary, I want to just go through everything and talk about how this really can change your overall clinical practice. The course is a little bit different from the standpoint that the goal is, yes, to change what you do, but more importantly, to create a lifelong learning environment for you where you will continue to grow and will change how you go about performing your clinical practice. And as such, this can create a situation where you will continue to give the best possible care to your athletes or patients, which is obviously the overall goal of all of medicine. And so the focus here is to put this all into perspective and wrap up all of the different things that we've been discussing so far. So we'll talk about how we can use these skills within our own practice, as well as how these skills necessitate the idea that you will be continuously updating your practice. If you're doing the same thing in 10 years from now as you're doing today, you're probably behind the times. And so the idea here is if we can set up a situation where you're continually improving and using evidence-based practice on a daily basis, you will naturally evolve as a clinician and will keep up to date with the most important and most relevant treatment techniques and diagnostic techniques. And then lastly, we also need to put this entire evidence-based practice situation into context with regards of our own healthcare and treatment philosophies. So when we talk about clinical practice and evidence-based practice, right, the idea here is that we have to incorporate evidence-based practice into our normal routine. So we know the value of evidence-based practice and the different factors associated with it regarding evidence, clinical experiences, and athlete values. But what we need to understand and really do is figure that evidence-based practice is not how we learn new things, but is in fact how we justify and continue to do the best care for our athletes. And so we need to prioritize evidence-based care within our routine just as much as anything else. The idea very much of the story of the man who has been sent to clear alligators out of a swamp. And so the idea here is you can spend your entire time sitting there chasing alligators and trying to kill them off one by one, or you can go ahead and drain the swamp. And by draining the swamp, the alligators will naturally leave and move on. Evidence-based practice is the same thing. You can consciously try to spend your entire day in your entire clinical practice chasing alligators or just chasing the latest thing that walks in to your clinic as far as treating each individual patient and just continuing to try to survive by doing what you already know and doing what's easiest. Or you can drain the swamp by using the evidence-based practice models that we have taught here to make sure that you are doing the most effective and the most appropriate treatment, thereby creating a situation where we may even be able to move to injury prevention and saving time. This idea here is that evidence-based practice needs to be a priority within the routine. Otherwise, all you're doing is standing still, which means you'll eventually get passed by. And so the idea here is you need to be prepared to overcome barriers. And these barriers are things that most of the time are simply put up by us to justify taking the easy way out. So the idea here is that there are barriers that are real, but we need to be proactive in justifying how we can go about making sure we have the ability to overcome those barriers in the future. And so the most important barrier that you need to come up with a plan to overcome is the lack of time. And the idea here really is that there's oftentimes the athletic training room is a very chaotic and busy place. And that is very true. And there may not be time for you to do an evidence-based practice search before every single treatment. However, there is always downtimes associated with athletic training. In fact, one of the things that athletic trainers often complain about is the number of unproductive hours that they just have to be there, whether it's while the team's watching film or it's in the morning when it's a little slower. This is when you can prioritize your continual learning and your evidence-based practice program. So you can create anything from just a list of clinical questions or searches you want to do, or use this time to keep up with some of the resources we'll discuss later. The rest of the barriers listed there are things that we've tried to address within the course of this series of lessons. The lack of equipment and access to literature we showed you, and as far as lack of informational resources, we showed a lot of even free resources, as well as opportunities for you to try to find different resources regardless of where you're at. Lack of generalizable research, as far as finding specific research, we talked about ways to manipulate the interpretation of individual research cases, as well as how to go about finding the most relevant research with the number of research studies that are being produced on a regular basis. This lack of specific research that you need for your clinical question will continue to decrease. And so the idea that you can't find the research is becoming less and less of an issue. And then we spent the vast majority of the course trying to increase your overall knowledge in how to complete these evidence-based practice components. And so there's lots of different things that you can focus on and continue to learn. But by doing the evidence-based practice searches and, well, the procedures throughout your time, you will naturally get better at doing it. And then lastly, the evidence-based practice culture is not well established in athletic training, and that is very true. You may be one of the few that prioritizes including evidence within your practice, but that is what's going to keep you relevant and at the top of the profession. And you're really at the forefront of helping to establish this culture. If you prioritize within your own practice using research and keeping up to date with the most up-to-date and most relevant treatment techniques or diagnostic techniques or any sort of interventions, then others will notice that and they will start to become involved, and you'll have a culture that you will be able to build that will be continually growing and thereby offering the best care to our athletes. That's always the goal. And if you ask any athletic trainer, they always talk about that they love that they are able to help people and help the athletes. Well, one of the best ways to legitimately help the athletes is prioritizing increasing your own knowledge, as well as prioritizing the time that it takes to make sure that your treatment that you're giving them is the most beneficial, as well as offers the greatest chance of success for that athlete. The athlete is much more likely to be willing to wait a little bit in exchange for giving you the time to make sure that they find the correct treatment. And you can just do this by either finding some other ways to go about doing your treatment and searches, or you just be more creative, right? The easiest way oftentimes is to use the mornings where it's a little bit slower to catch up on some of those searches from the previous day. The other aspect that's been very helpful is this fact that you can do most of this now on your phone or a tablet while at practice. And that practice is often one of the most down times in athletic training. We're there in case something happens, but oftentimes things are not happening. And so you can use that time to figure out what you need, or to look up what you needed to look up during the mass chaos that is pre-practice. And as you continue to perform more of these searches, you'll become more efficient with each of them, and it'll take less and less time. So the point being is you need to get started, and get started early in your career, utilizing these downtimes to prioritize increasing your own knowledge level, as well as making sure that you're doing this evidence-based practice within your normal practice, so that each of your treatments continues to be the best that it can be. And then we talked about how whether or not you should implement the findings. And to review that, it's relatively simple if you get down to it. Were the patient similar to yours? Does the inclusion criteria match as far as your athlete? And then you get into this idea of, are the outcomes clinically important, and are they considered? What are the benefits versus the risks? And if they have a positive outlook on all of those, then you're going to implement those and continuously improve your overall treatment. As far as dealing with conflicting or no evidence, right? This is the conflicting evidence is very common. The no evidence is becoming less common, right? If you perform a search and there is no evidence, right? That's okay. That just means that there has not been research conducted on this topic, and you're going to rely on your clinical experience, right? The clinical experience is part of evidence-based practice, so you can still be practicing via an evidence-based practice model, even if there is not the evidence that you need. That's where you can use some of your own evidence and your own data that you're collecting, as well as continually updating your searches to see if anything does come up. But using your own clinical experience is part of evidence-based practice, but only as a part of it. It cannot substitute for the continual learning of the best evidence. And as far as conflicting evidence, right, there's all sorts of different ways to associate that, right? That's where your critical appraisal that we talked about in step 3 becomes important. Not all of the evidence is going to be equal. And then, you can always look for systematic reviews or these clinical practice guidelines in order to help you understand that. And these clinical practice guidelines and systematic reviews are kind of this highest level of evidence that you can use. They really do try to focus on making evidence-based practice as easy as possible. And the clinical practice guideline, right, is just that, where the systematic review focuses more on the research, the clinical practice guideline focuses on the application. And so these are things like our position statements from the NATA. And there's a database that houses all of these, but they're specifically designed in order to make it easy for the clinician to find what they need and to apply it in these different situations. And so, although there's pluses and minuses to systematic reviews versus clinical practice guidelines, there are a lot of opportunities for you to read single articles that discuss a wide range of the literature, thereby decreasing the overall amount of time that you need. And at that same note, one of the most important things you can do is also prioritize the use of technology to keep current. And this idea is, we've been talking this entire course about what is termed pull technology. Basically, you have to go to the technology and pull out what you want. There are all sorts of push technologies, which basically you go and you set up reoccurring things like that MyNCBI, right, through PubMed we talked about. But there are RSS feeds and podcasts and all these sorts of things. The Journal of Athletic Training has an RSS feed which will send you the titles of the most relevant research as it comes out each time. As well as there are numerous apps that are becoming available that are designed to do evidence-based practice in real time, where you can buy apps associated with the evidence for each diagnostic test, treatment things, all these different aspects. And you see these apps that are being marketed just to the general public, but there are much more sophisticated apps specifically for orthopedics and other different um, specialties. And so you can go through and use this idea of technology to greatly decrease the amount of time that you need to spend, thereby doing some of the searching for you and sending it directly to you. So that's a little bit about the overall evidence, but really, when we get to evidence-based practice, it's all going to end up coming down to clinical expertise and your clinical experience. And your clinical experience is going to always be heavily weighed in favor of what you learned as a student, and specifically what you did during your most formative clinical experiences. Research has been very consistent that athletic training students are most commonly going to perform treatment similar to their clinical instructors during their student experiences. As such, you run the risk of always being a little bit behind. And so you need to find a way to prioritize this evidence to continuously change your level of clinical experience and your clinical expertise. By the time you continue to learn stuff, this ends up being outdated. And so oftentimes what you need to do is make sure that you are staying up to date with the most current conditions and the most current interventions. And so as evidence is being created, you need to find a way to continue to consume that research. Otherwise, you are not practicing at the highest level, and you're really doing your athletes and yourself a disservice. And one of the best examples of this is the knee meniscus injury test and different components, right? When I was a student, Apley's test was taught, and McMurray's test was considered the cool new one to replace Apley's. Now the Thestley test has been invented and published, and it's a lot easier, and as you can see, it's a lot more accurate. So the idea of doing a McMurray's test, which we've all been taught, and I'm sure is very consistently done within most practices, right, is falling behind. If you want to more accurately determine whether or not an injury has occurred to a meniscus, this Thestley test is a lot better as far as how to do that. And you would only know that if you were continuously up in the literature. And so this idea and this example is designed to convince you that you need to continue to prioritize this evidence-based practice model, so that way you can continue to grow your clinical expertise and not just do the same thing over and over. One of the things that creates a professional is that each year of experience should be different, and you grow from the previous year of experience. And this can only occur if you learn and do new techniques and new interventions. The idea that a typist over 20 years basically has 1 year of experience 20 times, whereas a writer now has 20 years of experience, where each year they grow and become a better writer. And so if you want to be the writer of the group and the leader of athletic training, you need to continuously be improving what you're doing. And so the way that you treat an ankle sprain should change each year and with each patient in order to provide the best care. And if it's not doing that, if you find yourself doing the same thing year after year after year, it's time to look and make sure that really is the most current and best component. And the last thing to focus on is this idea of patient values and athlete preferences. If you ask any athletic trainer, at some point in their description on why they get into athletic training, they talk about how they like helping people and working with the athletes. And so oftentimes that's what ends up becoming a barrier to evidence-based practice, is the fact that there are so many athletes or so many patients that they need to treat that they feel like they don't have time to focus on themselves and increasing their own knowledge. Right? But if you don't focus on the patient value and you start to assume your own values associated with that by continuing to do the same sort of thing, you get into difficult situations. The most difficult situation that has occurred over the course of athletic training that's important to focus on for a minute here in the evidence-based practice model is this idea that we usually have the ultimate goal as being return to play. But evidence has shown more recently that this isn't the only goal for our athletes. And so we need to find a way to communicate with them to make sure that we're addressing their overall goals and not just assuming and addressing these return to play. And the first component very much is this idea of listening. And usually with athletic trainers, listening is fairly routine. You're able to develop a fairly good rapport with your athletes. But oftentimes, if you really listen and then act on that, you're going to incorporate a whole bunch of different interventions that you may not normally do. And that's a great place for evidence to start to play, right? This idea of what's troubling them with their injuries, what are their immediate long-term goals, what are their most important aspects of how their injury is affecting their lives currently. These are different things that will dictate different treatments to each patient. And so this is where your evidence needs to come into play. First, you have to care enough to listen. And then second, you have to care enough to do something. And so it's important that you use these evidence-based principles to treat the entire person. And then from there, make sure that you're communicating effectively, not only with your patient, but with all stakeholders. And this idea that using your evidence allows for more consistent and more forceful communication, where you can communicate with athletes, coaches, parents, administrators, families about why you are doing things, and that this, in fact, is the best situation. It allows you to not become a servant to coaches or to administrators, because you have a justification on why you are choosing to do things and why what your choice is in the best interest of the patient. So this idea that as healthcare providers, we somehow need to lay down to the wills of coaches when it comes to medical decisions, and most common everything from mandating taping to poor warm-ups or anything like that, because that's what the coach wants to do, and he's the boss. If you have the evidence in there and you prioritize using evidence, you can communicate effectively that that's not the appropriate thing. And oftentimes, if your goals are aligned, which is most of the time the case, right? Coaches want what's best for their athletes as well. And so oftentimes it's just using the evidence to communicate with them what is best and what is ideal. But lastly, when it comes to athletic training and evidence-based practice, you have to simply come down to this idea of altruism and practicing altruistically. So this idea is that athletic training and healthcare as a whole is focused on this idea that we are there to help people. We're going to believe in acting for another's good, right? And in order to do that, we need to prioritize the athlete's well-being and the athlete's care. And that means making sure that we're giving the athlete the best possible care and all the information they really need. And so in order to truly help your athletes, in order to provide the best care, it may not be as important for you to sneak in an extra, 3 treatments or to tape everybody so they know you care about them. It might be more important to spend some of that time and take some of that time to keep up with the amount of research evidence that's being published, so that way you know that your care is the best possible. It may be easier in the short run just to give in and do what athletes or coaches or administrators want you to do. But in the long term, it's not going to give your athletes the best care. And so you need to use what you've learned as far as the evidence-based practice model to truly be the healthcare professional that you want to be, and thereby provide the best care to your athletes, which is ultimately the goal. And so we talked about how to assimilate research skills into your everyday practice, right? And then, in the huge importance of make sure you're using this evidence to update your regular clinical practice. Evidence-based practice isn't just for what you don't know, but it's for double checking what you already do know and seeing if there's a better or more up-to-date version with that. And then finally, this idea that if we truly want to do what's best for our patient, and that's often at the heart of our clinical practice and why we became athletic trainers, then we need to prioritize this use of evidence to make sure that we give the athletes and our patients the best care that's consistent with the evidence, with their own values, and then our expertise.